Hi everyone, my name is Allison Fugel and I am doing my theory-based case presentation on the article for Una Rosa. The presenting issues is that the client was admitted to the hospital following a suicide attempt in which she had cut her wrists with a machete. The client reported experiencing feelings of shame and guilt, which ultimately led her to her suicide attempt. The client also reported that she felt as though the recent relationship she had with a man romantically had triggered her depression as well as past trauma. When the client was 15 years old, she witnessed the brutal murder of her mother and father. Her father was shot to death, and her mother was raped and then killed with a machete. The client's younger sister, who was 13 at the time, was also raped, followed by the client, who was 15 at the time, being raped. So this trauma has stuck with the client for all these years. She had never sought out help for her trauma, always pushed away the trauma and thoughts of trauma, and never really processed it. So the client feels as though this relationship that she had with this man triggered thoughts that she didn't deserve to live, as well as feelings of shame and guilt, and this is what led to her suicide attempt. The client is currently a 25-year-old single Guatemalan woman. She was raised by a family of farmers. She was raised by her mother and her father, along with her younger sister. She attended school as well as helped her parents take care of the farm, which was really common for children in Guatemala. At 15 years old, following the death of her parents, the client moved in with her aunt, uncle, and cousins. It was then that she began to help her uncle by working at the family grocery store. The client grew up in the Western Highlands of Guatemala, and in Guatemala in general, there is a very strong stigma against mental health and a lack of mental health resources in Guatemala. It is really important when working with a client to try and understand where the client is at presently. So that includes looking at their history, looking at their past trauma, how they were raised, where they grew up, their culture, looking at all these different aspects about the client and their environment, and trying to understand where they are at now with their current situation. So for this client, she did have extensive trauma witnessing the murder of her parents, being raped, as well as her sister being raped. And following this trauma, she worked really hard to suppress it by distracting herself with work and her religion. She has a really strong connection with her community and her religion, which is good, but she utilized that as a way to distract herself and to basically ignore that trauma and push it away and not address the trauma or process the trauma within the last 10 years since she was 15 years old. Some strengths that the client has, which is also important to point out, is that she does have a strong relationship with her culture and her religion. Like I said, she goes to church, she's active in the community, she has a desire to help others and to constantly learn and to actively engage within her community. She does have a social support network with the individuals at work. She also works at her uncle's grocery store, and work has also been, a big distracting technique for her to kind of ignore that trauma, but it does give a strength in the fact that it is a strong social support network for her. When working with this client on her trauma and being able to process that trauma, I think there are two theories that would work really well for treatment with this specific client, and the first one being the strengths perspective. The strengths perspective is exactly how it sounds. It focuses on strengths. So not only the client's strengths, but the strengths within her environment, so within her family and her community. Social workers address issues by utilizing the client's strengths, her abilities, and the resources, and capitalizing on those strengths. So using those strengths to their advantage in her treatment and letting that be the guide for treatment. In addition, the strengths perspective is known to be more culturally sensitive, and that's because the practice is adaptable and creative. So it is a good one to utilize when working with a range of communities, cultures, and different people. Some strengths and limitations of the strengths perspective are that, for strengths, the strengths perspective acknowledges and utilizes a person's strengths, which is really good because it's pointing out those strengths, which not only helps in acknowledging that a person does have strengths. It helps with self-esteem. It helps with boosting the client's morale and showing them that even though we're in this bad situation or things might seem so tough, there are strengths, and you do have strengths that we can use to help you. It promotes resiliency and empowers the client in that way. Some limitations are that it is hard to measure the effectiveness of treatment for the strengths perspective, and sometimes it can be seen as minimizing a client's situation, which has been found in research studies for the strengths perspective. When looking at the implementation for the strengths perspective, we can first look at engagement. So building a rapport with the client and ultimately building trust with the client. And for the strengths perspective, we can do that while also empowering the client and acknowledging that they are the experts in their own lives. So the clients know themselves the best, the clients can acknowledge their strengths, and the clients can kind of lead their treatment and lead this session of building their rapport. They are the experts in their own lives. Next, we look at assessment. So collecting information to understand the client situation best. So this assessment in the strengths perspective focuses on, their strengths, takes into account the different challenges that the client has encountered, and incorporates the client's viewpoint on the different types of situations that they've been in. So the strengths-based evaluation also makes an effort to gather information regarding a client's strengths, previous achievements, and other positive aspects of their life to use that in treatment. For goal setting, when deciding what they want to accomplish and how to attain their goals best, the client takes the lead in the strengths perspective. So rather it being the therapist knows best and the therapist sets the goals, the strengths perspective really focuses on the client taking the lead and the client having a say in their treatment, and again being the expert of their own lives. For intervention, for the strengths perspective, it's really engaging in activities that lead to positive changes while utilizing the client's strengths. The second theory that I think would be beneficial for this specific client is the cognitive behavioral theories. So behavioral theories explain how our behaviors are influenced by the events that occur before a behavior takes place and the results that occur after the behavior. Cognitive theories demonstrate that ideas have an impact on behavior in addition to consequences. So when we're looking at both of these things, it really focuses on classical conditioning, which is the behavior explained by antecedents or what happens before the behavior. Operant conditioning, which is behavior explained by the resulting consequences of that action. Cognition, which is automatic thoughts and core beliefs that influence emotion and behavior. Imitation, the process of learning what occurs when observing a model. Reinforcers, consequences following a behavior that increase the likelihood the behavior will occur again. And punishers, consequences following a behavior that decrease the likelihood the behavior will continue. Cognitive behavioral theory and the treatment that has been associated with it, known as cognitive behavioral therapy, is the most widely used intervention across social work settings. It is really good at being used for all ages. It is well known for adolescents, young adults, but it is utilized across all ages. It's also culturally diverse. It is focused on the client and adaptable for the client, so it is able to be adjusted for cultural diversity as well as different ages, so it is adaptable. There are extensive research studies that have been conducted on many different psychological disorders, so there are well-known benefits to different situations that clients may have. Some limitations for cognitive behavioral theory is that it doesn't focus as much on other systems within the client's environment. So it doesn't focus on, the meso, the macro. It's really just focusing on the micro. So really focusing on the client themselves rather their environment. And then clients have less say in their treatment. It is, with that thought process that the therapist is the professional, the therapist has the education, so the therapist is really leading the treatment in this theory, whereas the strengths perspective, like we talked about, is the client is taking lead of their own treatment and the expert of their own life. For the implementation of cognitive behavioral therapy, we can again look at engagement. So, social workers helping clients and their families have open discussions about challenging subjects through modeling and shaping. So, using a diverse way of communication and adapting communication for the client, and in that way, being able to build a good rapport and trust with that client. Assessment. So, collecting information through interviewing processes and observations to best understand the client situation. So, social workers specifically collect information regarding what happened before the situation or behavior, the environment at the time and currently, as well as reinforcements to the situation or behavior. Next, we look at goal setting, and this is just setting goals that can easily be tracked and measured with a realistic timeline for the client. As well as intervention, so utilizing things such as desensitization, cognitive restructuring, and psychoeducation through this theory to help a client in treatment. Now, with cognitive behavioral therapy comes cognitive behavioral therapy, also known as CBT, and it is very widely used in the social work field. And this is a counseling treatment program implemented by social workers and others in helping professions to address psychological distress. The two grounding principles for CBT are that 1, our thoughts influence our emotions and our behavior, as well as 2, our behavior can influence our emotions and thoughts. So CBT really focuses on utilizing cognitive interventions as well as behavioral interventions, so combining those. And this can include something like changing the client's daily schedule to promote positive change, or giving a client therapy homework to implement goal setting and the utilization of skills and working on those goals, and then checking back in on those goals within therapy. Although both theories, the strengths perspective and cognitive behavioral therapy, have their advantages and disadvantages, I think either of them could be beneficial to the client, but if I were to pick one, I personally think cognitive behavioral therapy would be a really good choice for this client. Cognitive behavioral therapy is focusing on the restructuring of the thought process, and this is really, I think, would be really beneficial for the client in helping her process her trauma and her past. Additionally, the client did state that she wanted a more direct approach when meeting with her social worker in the hospital. She didn't like the approach of strengths perspective at first, and feeling as though she needed to take lead in the conversation and talk about her strengths. She really wanted, that help from a professional. She was really seeking out that professional opinion, and you're the professional, please help me and tell me what to do. So I think that goes better with CBT. Not to say that with the strengths perspective you can't adapt, but I think that specifically CBT would be better for that. Cognitive behavioral therapy also has a more in-depth assessment, so really focusing on the past, focusing on the trauma, focusing on behavior, situations, reinforcements. So, not just focusing on the client's strengths and her environment strengths, but diving in to learn all about her past and the trauma that she endured. It would also be really beneficial, I think, for this client to engage in cognitive behavioral therapy. I think it'd be really good for her to focus on that cognitive restructuring, like I said, and making positive changes within her current daily life, as well as building some skills to help with her depression and those symptoms that led to her suicide attempt. Some other considerations that I think it is important to take account of when working with this client specifically is the cultural differences. She is from Guatemala and a very different background than many other people. And so I think it's really important to take that into consideration, especially because of the mental health stigma that they have in Guatemala and the lack of mental health resources available. She had to suppress this trauma for 10 years, 10 plus years, and that takes a toll on her. And so I think it's really important to address that and understand the fact that, she has this suppressed trauma that she has not been able to process or work on for a decade, and that she has never been able to ask for help because of that mental health stigma and the lack of resources available to her. So I think these are really important to take into consideration when working with her. Thank you.